Welcome to ADP for Learning. I am Ashish Kutyal. Today we will learn about a new topic that will unveil the reason for urine analysis. So, the question arises, how our urine can reveal our health and diet? As urinalysis is a routine part of many medical examinations, laboratory tests of the chemical components of urine can reveal many health problems. 1. More than a trace of glucose may be a sign of diabetes, a high carbohydrate diet, or stress. Stress causes the adrenal glands to release excess epinephrine, which stimulates the liver to break down more glycogen into glucose. 2. Albumin may be a sign of damaged nephrons since this plasma protein does not normally fit through the pores of intact glomerular capsules. 3. Together, pus and an absence of glucose indicate a urinary tract infection. The pus consists of infection-fighting white blood cells along with bacteria, which consume the glucose. 4. Traces of marijuana, cocaine, and other substances may appear in the urine. Athletes and employees of some organizations routinely submit urine samples for drug testing. Although urine is usually odorless, some foods impart a distinctive aroma. Asparagus, for example, contains a sulfur-rich molecule called mercaptan. Many people produce an enzyme that breaks down mercaptan, and the products of the reaction have a strong odor. So, another question arises about the color of urine. Why is it normally pale yellow? The pigment that lends its color to urine is a byproduct of the liver's breakdown of dead blood cells. A reddish tinge may suggest anything from bleeding in the urinary tract to beet consumption to mercury poisoning. Either vitamin C or carrot consumption can color urine orange. Urine color can also suggest whether a person should drink more water. If urine is dark yellow, the kidneys are working to maintain blood volume. Capillaries along the nephron are reabsorbing almost all of the water that is filtered at the glomerulus. Colorless or light yellow urine usually indicates excessive water intake, but not always. Alcohol and other diuretics stimulate water loss even when blood volume is low. A headache soon follows. To prevent or cure this painful side effect, experts recommend drinking more water, both with alcohol and after the merriment ends. Thank you for listening and exploring the amazing journey of learning. In the future, we will come up with more interactive topics. Meanwhile, don't forget to like, share, and comment.